Assalamu alaikum everyone. Hope you all are doing well. We started our prosthodontics, okay, in which we covered, I uploaded the two lectures. In first lecture, we covered chapter 1, which contains some basic knowledge about RPDs, removable partial denture, and then in the second lecture, we covered chapter 2, in which we studied different types of removable partial dentures. So this is the chapter 3 of this and third lecture of this prostho series. Okay, so in this lecture we will be covering Kennedy's classification. Okay, so let's get going. Okay, there were different classification systems proposed for prosthodontic treatment. Okay, some of them are like Kennedy's classification, that is the most important one, and we'll be studying about that, mainly focusing about this classification in this video. Then there were some other people also like Commerce and Byland classification, Beckett, Godfrey, Swenson, Friedman classification, Wilson classification, Skinner's Applegate classifications. All these scientists, all these people also gave their way of classifying edentulous span area and making a prosthodontic appliance. Okay, so why do we needed a classification in the first place? Why we needed a classification? Okay, so the purpose of a classification is to facilitate your treatment planning, and it helps in determining the complexity of a treatment based on four diagnostic characteristics. Okay, these four diagnostic characteristics helps in determining the complexity of the treatment. So what are those four? That location and extent of a edentulous span, conditions of the abutment tooth. Okay, what is the condition of the that we studied in the last lecture, that if abutment tooth doesn't have a good pedial support, so that's the lacking of that tooth, or there's a lacking then in that appliance. Okay, you have to go for another type of appliance. I think we studied this in cast partial dentures. Okay, so what is the condition of the abutment tooth, occlusal characteristics and requirements. Okay, and ridge, residual ridge characteristic, how much of the ridge has resolved and how much of the ridge is there if you are giving a tissue supported prosthesis. Okay, so you have to check all these four things. On the basis of these four things, you say that your treatment is this much of complex. Okay, so this is the purpose of a classification, to help you determine and facilitate your treatment planning. Okay, so what is the acceptable method of a classification if you are proposing a classification? So why will be it accepted? Okay, so how you're going to make it accept your classification that you're proposing, or the classification that has been proposed, should permit immediate visualization of the type of partial edentulous arch that is being considered. Okay, it should also permit immediate differentiation between the tooth supported and tissue supported movable partial parts. It should be always universally accepted classification. Many people worldwide, it should be accepted. Okay, Kennedy's classification, the most common and most worldwide known and most worldwidely used classification, is your Kennedy's classification. Okay, so Kennedy's classification was proposed by Dr. Edward Kennedy. Originally he proposed this classification. Okay, this classification uh, says that um, it has four basic classes. Okay, Kennedy's classification is further subdivided into four basic classes: class 1, class 2, class 3, and class 4. So class 1 states that bilateral edentulous area located posterior to natural teeth. If you can see this diagram here, okay, this picture that shows you four different types of Kennedy's classification. So the first class says that there should be bilateral uh, uh, edentulous area, okay, which is located posterior to the natural teeth. Okay, these are the teeth that are present in this patient. Okay, and this is the posterior area of the natural teeth, and it is bilateral. Okay, so this kind of a class is your class 1. Then the second class says that a unilateral edentulous area located posterior to the remaining natural teeth. So a unilateral area, okay, located posterior to the remaining natural teeth. These are the remaining natural teeth. This is a unilateral area. It's not bilateral. See, it's the teeth are missing from the one side, not from two sides, like seen in this picture. Okay, so teeth are missing from the one side and posteriorly. They are missing posteriorly. So a unilateral edentulous area located posterior to the natural teeth is your class 2, Kennedy's class 2. Then your class 3 states a unilateral edentulous area within the natural teeth remaining both anterior and posterior. So you have a unilateral edentulous area, and to that in edentulous area, that edentulous area have posteriorly natural teeth present and anteriorly natural teeth present, and in between you have some teeth missing. So this kind of a class is your class 3. Then fourth class of Kennedy's classification states that a single but bilateral means that it should be crossing the midline. Okay, edentulous area located anterior to the remaining natural teeth. Fourth class states that a single bilateral area, okay, a single but bilateral area. In what way? That it's crossing the midline. Okay, it's crossing the midline, and the teeth that are missing are anteriorly. Edentulous area is located anteriorly to the remaining natural teeth. Okay, this kind of class is your class 4. Hope all these 4 classes are cleared here. If not, comment down. um, I'll I'll try to sort this query out of yours. Okay, so there are 4 basic classes of Kennedy's classification. The class 1 states that bilateral edentulous area located posterior to the natural teeth. Class 2 states that a unilateral edentulous area located to the remaining natural teeth, posteriorly to the remaining natural teeth. Class 3 states that a unilateral edentulous area with natural teeth remaining both anterior and posterior to it. And class 4 finally states that a single but bilateral area crossing the midline, okay, edentulous area located anterior to the remaining natural teeth. These are the 4 basic classes of Kennedy's classification. Okay, the edentulous area, other than those that determine the basic classes, okay, like if this is the side that determines your basic class and here is some other teeth missing, okay, that other teeth missing area is called your modification area. So the edentulous area other than those that determine the basic classes were designated as to be modification areas. Okay, these areas, these 4 classes and these 4 areas tells you determine the class. Okay, and apart from these areas that are explained here are your modification areas. Simply it says this. Okay, so rules covering the application of Kennedy's classification. You have a classification with 4 classes now. Then there are some rules applied to those classes. Okay, there are in total 8 rules. The first rule states that classification should follow rather than precede any extraction of the teeth that might alter the original classification. Means if you want to diagnose a class and there are also some teeth that has to be extracted, so first you send the patient for extraction. Okay, ask the patient to extract these teeth out, then you diagnose which kind of a class that patient has. Okay, rule 1 states that. Then rule 2 states that if a third molar is missing and it is not to be replaced, it is not considered in the classification area. Simple. If there is a patient, you have mostly third molar impaction, or you don't have third molars in your cavity in most of the patients, so if you don't want to replace that third molar, then that third molar is not considered in your classification. Okay, on that missing area you cannot classify a patient. Okay, you're not going to determine any class on the basis of that missing third molar. It is not, if you're not including it in your classification, it is not considered. Then the third rule is, if a third molar is present and is to be used as an abutment, it is considered in the classification. Simple. If the third molar is present and you want to use it as a support, you want to use it as an abutment, you can consider it in a classification. Okay. Then the rule 4 is, if a second molar is missing and is not to be replaced, it is not considered in the classification. Example, if the opposing second molar is likewise missing and is not to be replaced. Okay, if there is a missing of second molar and you don't want to replace it, similarly like the third rule, there was missing third molar and you didn't want to replace it, so I mean second rule, you didn't want to replace it, you are not considering in the classification. Similarly, in the rule 4, there is a missing second molar and you don't want to replace it. Okay, so you are not considering that missing second molar in the classification. Rule 5 says that the most posterior edentulous area always determine your classification. The most posterior, like you have a patient who have multiple missing teeth. Okay, so if there are multiple missing teeth, how you are going to classify, how you are going to determine the classification? In such patient, you look out for the most posteriorly missing edentulous area. If such kind of place edentulous area is present, then that area will be determining your classification. Which kind of a class is that? Basic class. Okay, then rule 6, it states that edentulous area other than those that determine the classification are referred to as modification area and are designated by a number, by their number. I explained previously in the previous slide that if there is a edentulous area and it is not determining any classification, so that other area other than classified area is your modification area. Okay, then rule 7 states that the extent of modification is not considered, only the number of additional edentulous area is considered. Okay. Okay, then rule 8, that will be the last one I guess. The no modification areas can be included in class 4. Okay, if a patient have, if there is a class 4 arch, okay, arches, if there is a patient who have bilaterally missing anterior teeth, okay, then, and no other area of edentulous area, okay, in that patient, then that you can consider in class 4. But there is a miss area patient, sorry, there is a patient who have anteriorly missing teeth, okay, and that missing area is also crossing the midline, okay, bilaterally midline crossing area, edentulous area there is present, but he also have some missing teeth in the posterior region as well. Okay, so now you will not be counting this this as a class 4 classification. Why? Because he have some posterior missing teeth. And what the rule 5 says, that most posterior edentulous area covers your gives your basis of the classification. Okay, so if there is a patient who doesn't have any missing teeth posteriorly, but he has anterior missing bilaterally, that is called crossing the midline, such is called class 4 classification. Okay, there shouldn't be any modification area in your class 4 arch. So these are the 8 rules covering the Kennedy's classification to determine the classes and modification areas. Okay, I hope it's all clear now. If not, comment it down. I'll try to sort your queries out. Okay. So there is this little exercise that I included in this lecture to help you understand Kennedy's classification. Okay. So now you see this here will you'll clear out this 8th rule. Okay, see, these are posteriorly present teeth and here are also posteriorly present teeth, and see, this is your single edentulous area which is crossing the midline. Here be this, here it will be your midline. Okay, it is crossing the midline and there aren't any posteriorly missing teeth. So what does that mean? This is your class 4 Kennedy's classification. Okay, then this is the second one. here are three missing areas of teeth, okay? Posterior one, then this and this. What does the class 5 state? That the most posterior teeth, most posterior edentulous area is your, which one considers your like classification basis. So this is the most posterior area, okay, and this is your class 2, okay, class 2. And how much modification areas we have? 1 and 2. So this is your Kennedy's class 2 mod 2, okay. Then is your, the modification area is called mod, and class, you identify the class, okay. So this is the third one, and it is your most posterior area is which one? This, okay, or this you may say. So this is your class 1 mod 2, okay. Then you have this. See here, multiple missing areas. So which one is the most posterior area? This. And which one is this? Class 3. Class 3, and how many modification? 1, 2 and 3. So class 3 mod 3. I hope you're getting what I'm doing here, okay? So most posterior area, these are the okay. So both are the same. Either you can consider this most posterior, this most posterior, other than other one is going to be a mod, okay. So this is your class 3 mod 1. Then you have this, and these are the most posterior areas, okay. So this one will be class 3 mod 1, okay. Then you see this is your class 4 bilaterally missing teeth and no modification area. So this is your class 4, and this is your class 2, okay, missing teeth anterior to the posterior to the remaining natural teeth. So this is your class 2, and then this is your the most posterior area, okay. This is your class 3, and this 1 2 3 4 5, class 3 mod 5, okay. So I hope it's clear to you now more. So that'll be all, okay. So okay, if you have any query, okay, I hope everything is clear here. If you have any query, if you didn't got anything here, so do comment down and I'll try my best to sort that query out in other lecture or in the comment section, or however that is feasible to me, okay. So do comment down, do like, do share my videos, and subscribe my channel, and also follow me on Instagram by the name of, I go by the name of Dr. Barira Mushtaq on Instagram as well. So thank you, uh, and take care. Allah Hafiz. Bye bye.